very interesting actually, because those who remained in the study seem to have quite a nice weight loss maintenance, with all the benefits that come with that. We didn't really find out much about those who dropped out. And I think this is actually one of the challenges with lifestyle interventions, trying to consider what the reasons are why people are unable to maintain these interventions over a long period of time. And I'm sure further work is necessary in that area, and actually will be quite useful and practical actually in primary care when seeing patients and discussing these potential interventions, because I think that's probably an area of need and motivation actually for a lot of our patients. I thought it was quite interesting the way they had set up the study with the initial 8 weeks of low-calorie diet, bringing about quite a rapid weight loss. And the comment during the presentation that that changed the patient's mindset, seeing such a rapid loss of weight actually reinvigorated the patients and gave them some positivity going into the following 3 years. However, against that was the high dropout rate in the study. But I'd certainly take that back, that the early weight loss could be something quite impactful. But again, we know that it's the maintenance of that which is so challenging. So a bit of a mixed picture. It was interesting to see that they looked into the psychological aspects of things and those who dropped out after a year versus those who completed at 3 years. Things like hunger, so less hunger at the end of for those who continued for 3 years. Less stress, less perceived stress. And I think these are some of the soft markers that are actually quite critical and important in lifestyle interventions. I think it's difficult to tell. It's most likely a number of things. And also that perhaps there was a bit of selection bias there. Those who remained in the study tend to be more psychologically positive and in tune with the whole process. Very tricky to take things directly back into practice, but a little bit of food for thought, as I mentioned in the presentation. But certainly thinking about low-calorie diets and their place in the management. And in terms of maintenance, a few things to take back, but I think I'd like to see more work done in this area really before we can start implementing it locally. We have the diabetes prevention program active in our area, and it was nice to see that they did talk about the number of times the participants were having interactions in group scenarios, which is very much what we're doing locally. So that was nice to see and see that does seem to have a positive effect. But yeah, as I said, there's still a lot of work to be done in this area, and I look forward to the studies that will come and the further results from this particular study as well, actually.